Okay, so the factor that increases risk of malignancy of the nodule is a large size, advanced patient age, female sex, active or previous smoking, family history or personal history of lung cancer, upper lobe location, speculated borders. All of those increase risk for malignancy. So fibro-optic bronchoscopy, we do it. It can be appropriate in taking diagnosis. This one is mostly for centrally located masses, not peripherally. This is hard to get that peripherally. Okay, so peripherally located require percutaneous biopsy. It's not fibrotic. So if it was percutaneous biopsy, then it would be better answer. Induced sputum cytology has very low sensitivity of detecting cancer. No additional intervention. Come on, the patient is having cancer. He's gonna die soon. Okay.
Okay.
Yeah. Repeat CT in 6 months. This one, if it's low risk nodule, if it's less than 0.8 cm, and low probability of malignancy, like patient who's like the not smoker, who's like 40, 50 years old, something like that, and doesn't have speculated borders, then I would repeat. But this patient is dangerous. Okay, I wouldn't wait on him.
So the answer is surgical excision.
Yep.
Okay,
Period.
got it.
Okay, this poor girl had a primary myelofibrosis, and it is very severe condition. She's pissed out of the medication, so she said, "I just don't want anything anymore." Okay, that's okay. I'm done. So what do you tell her? She has her mental capacity is okay. So you just tell her, let her go home. Okay. Ask friends. She did not want anyone to be involved. Contact son. She didn't want her son to be involved. Psychiatrist only if she's having psychosis or I suspect her decision-making capacity. Emergency, nah, she said, I don't want anything. Okay, that's okay. This is autonomy. You can't refuse medication or anything. That's okay. Okay, so that's the answer. You're right. Okay, period. Okay, so this case, any patient who you see who have increased insulin have a sign of hypoglycemia, therefore is loss of consciousness. Increased insulin, increased C-peptide, increased proinsulin. The first thing you do is that you do oral hypoglycemic agent screen because it could be sulfonylurea. Okay, so if you're taking exogenous
Right,
insulin, if you're taking
right.
exogenous insulin, the serum insulin could be normal or increased. C-peptide will decrease, and hypoglycemic drug assay will be negative. If you're taking hypoglycemic agent, the C-peptide and insulin will be high, but the drug assay will be positive. So, insulinoma exactly the same thing. They have an increased insulin and C-peptide. It could be normal too, but the drug screen will be negative. So rather than to going to the route of tumor, you can just do simple drug test, urine drug test. Will be able to find what's going on. So a mixed meal challenge test, it's only if the hypoglycemia occur after eating that you do that. 72-hour, this one is called 72-hour fasting test. When do we use that? This one,
What is
this
mixed meal challenge test? What did you say?
is on
When person has
hypoglycemic symptom occur after eating. That's we use it when
hyper
yeah
or hypo?
hypo when hypoglycemic symptom occur after eating, we do that. Okay, and 72 hour like we keep the patient fast. We don't eat anything for 72 hours just to see to diagnose insulinoma. Will keep having high insulin after the 72 hour. Okay, so that's why it's not accurate or anything. Abdominal CT, I mean, it's not the first step, okay? That's the thing. Examine the patient for needle mark. This one, exogenous insulin. They will have decreased C-peptide, okay? So that's the difference. Okay, period. Let's go to the next. So this patient, right, our lower quadrant pain and nodularity on tenderness in the rectovaginal examination, this is most likely endometriosis. So you suspect it could be that infertility. It's an infertility. Cervical dysplasia is caused by HPV, which could be asymptomatic, okay, and can present with bleeding rather than pelvic pain. Primary ovarian insufficiency present with hot flashes, vaginal dryness. Another. Tuber ovarian abscess, they will have fever and leukocytosis. That's the main
I
thing.
will go, yeah, I will go with infertility. This is probably endometriosis.
Yeah, sarcoma have bleeding and irregularly shaped, rapidly enlarging uterus. That's how they present. Okay? Period.